find them at Mass General at least?
Some of them we have, some of them we haven't. Some who initially were unidentified, it took at least a couple hours. I know some of the patients that I personally treated, it took a couple of hours to find family. I don't know of the 29 total, or particularly the 11 who are in, 8 who are in critical condition, if we've been able to reach everybody.
Were these runners or spectators?
Again, I'm not sure. I have not taken care of any runners. But of the 29 people, there certainly may have been some.
Can you talk about the shrapnel
again?
again?
Did you see? Was it anything unusual or anything in particular?
So no, there's a lot of small metal debris. Some people have asked already about whether these were BBs or they were parts of bombs, and I just don't think we're able to say whether these are small bits of metal that were placed there intentionally or whether they were just part of the environment that were involved in the blast.
Do you think the people who are in critical condition at this point, are things looking okay for them, or do you think?
Well, they're not looking okay because that's not what critical condition means, unfortunately. So, it's really too early to say how everybody is going to do.
How long will it take you? How long will this process continue with the 8 critical? Are we talking about hours, or are we talking about?
A number of patients will require repeat operations tomorrow and serial operations over the next couple of days. So, as I mentioned, a lot of the injuries are combined. They're combined bony and soft tissue and vascular injuries, and they have to be approached oftentimes in kind of a stepwise fashion.
How about eardrums? Were you seeing any shattered eardrums? Were these people in very close proximity to the explosion?
Yeah, so we have seen at least one, which is not uncommon with blast injury. One of the things on the to-do list for tonight, for me and the residents, is actually to go right back around. It can be hard sometimes, particularly if people are being rushed to the operating room to get a good exam, and repeat all of those exams, because that's obviously something you don't want to miss.
More information, on ages, hometowns, where this.
No, I'm sorry, I can't actually. I just don't have that information. The hospital may be able to give it at a later date.
Can you talk about the amputees again? You've how many here at this hospital?
I can't tell you precisely right now. I mean, several.
All legs or arms
Are all
too?
29 still at the hospital now?
I don't know that.
And can you give us an age range? I mean, were there?
There were no pediatric patients, so here we define that as somebody under 18. So that's actually all I can tell you. The oldest patient that I took care of personally is 71. I think that's the oldest patient involved.
What was the most horrific thing you saw personally? What was the most difficult for you to? I mean, you're a surgeon, but still.
Yeah, I mean, it's just depressing that people. We take care of accidents all the time. It's just depressing that it's intentional.
Have you ever seen anything like this?
The injuries are not otherworldly, but no, I can't say I've ever seen this volume of patients come this quickly with this type of injury.
Can you elaborate on what you mean by not otherworldly? Some of the initial reports we've heard are that it appears that these devices may have been IED-like or crude in nature, but you say the injury is not otherworldly. What do you mean? Can you explain?
Well, an traumatic amputation is it's a gruesome injury, but it's something that we do see from time to time in the course of daily life, even outside of this type of event.
Mm-hmm.
But
was this tough on you? I know you're trained for it, but was it? I mean, did you think much about really what was happening, or does it kick in automatically?
No, I mean this is work. So when this happens, we just go to work.
And Doctor, you talked about injuries on a broad scale, but the 8 in critical condition. Can you elaborate on their injuries?
I'm hesitant to give you a kind of rundown of each of the 8, one by one. Again, the dominant injury have been combined complex lower extremity injuries involving blood vessels, bone, and soft tissue.
Do any of your colleagues have combat medical experience, and if so, have any of them made any comparisons to what they've seen?
One of my partners actually has been deployed to Iraq and Afghanistan, and I think has probably the most personal experience with these types of injuries. He's been here most of the night. But I haven't talked to him directly about how does this compare to what you've seen in the field.
What about some of the patients' mental? You said you were keeping it business for the most part, and they may not have said a lot. But did any of them say anything that gave you some sense of what this experience was like for them?
No. I mean, people they want help in this kind of situation, and my experience today is not unlike I guess other similar circumstances. I mean, they're pretty brave. It's a terrible thing, and most patients' attitude is just do what you have to do and try to make me better.
So, Doctor, can you describe
or some in and out?
Some conscious, some unconscious.
Doctor, can you describe, if you look over here a little bit, describe a little bit about the scene in the ER when it first happened?
We just got a series of patients on stretchers. Actually, none of them with of the first wave, even some that were very seriously injured. None of the first few had breathing tubes in, so they were able to talk, even if they were in and out a little bit. And again, when it kicked off, the most severe injuries were really these lower extremity injuries. And so we had, I think, 3 in about the first 5 or 10 minutes, and that's when it became clear to us that it was going to be a busy day.
Had you ever seen anything like this before?
Again, like I said, the injuries individually are not completely outside the pale of, but no, I've never seen this volume come this quickly.
There were 6 critical earlier. Now there are 8. What changed?
I'm not sure how they were classified or when. And I think certainly there's some patients who may not have been classified critically the moment they hit the door, or their status could have been changed within.
Doctor, earlier
given the
your
horror that
colleague
you've
had
seen,
mentioned that you were all trained by Israeli disastrous first responders. How did that help today in this situation?
I was not trained by Israeli disaster first responders.
Doctor,
Yeah.
given the horror that you've seen, we also heard the Governor Deval Patrick say that he's seen incredible signs of hope and of help across this region. And we've heard reports of people saying that even runners have called the hospital, offered to donate blood as soon as they could. That's being coordinated. Have you seen any of those bright signs in all of this horror?
Well, I mean, what I can say is within the hospital, certainly, everybody rose to the occasion. I mean, we've had people who were out of town who flew back in here and somehow made it back in within hours, from nursing staff to ancillary staff to operating room staff to specialists and really all of the different disciplines. We've had, as much or more manpower or people power than we could use. I can't speak to the larger scenario, although I was asked by the hospital to mention to anyone who was willing to donate blood specifically that it's appreciated, that right now we're okay. If they cannot forget that sentiment over the coming days to weeks, we are going to use a lot of blood with this incident, and it will need to be replenished. So.
Doctor, were the patients treated for biohazard residue, and how does that process work?
No, to my knowledge, they have not been, and they were not quarantined in the emergency department.
Earlier we had heard that the hospital, that all non-elective surgeries were being put on hold because of the number of patients coming in. What's the sort of status on where things are now, just in terms of the hospital search?
Yeah, I can't tell you that. I would be surprised if all non-elective surgeries. I can tell you that for our general and emergency service, we did cancel our scheduled cases for tomorrow, and we're going to have to just sort them out over the next couple days.
Did you say that all victims have been identified, correct?
No, I didn't.
No.
No, I didn't. I don't have that information actually.
Okay.
So.
And do you know if all have reached their family members?
Again, I don't know.
Can we expect further information tonight? Will we get further updates?
Tomorrow, probably.
Tomorrow. So I'm looking at Mike from our public affairs office. So it looks like the next press conference will be tomorrow.
Do you know if everyone's been
We don't have
identified?
anything scheduled yet. We're going to figure out where we are in the morning. We'll let you know. Public affairs on call is available 24/7. So.
Do you know if everybody's been identified and connected with their families?
I don't know that info yet.
Doctor,
Still working on that.
Doctor, how much is this a trying night for you and your colleagues and just the staff in general? How much of a trying day has this been, night so far?
It's been a busy day.
Thank you.
How many hours of surgery did you do if you added them all up? Approximately.
Pardon me?
If you added up the hours of surgery, you said you did six surgeries, right? How many hours?
Well,
altogether would you say you did?
I started doing surgery at 8 a.m. and I pretty much stopped to come talk to you. And actually, I'm going to have to go back. So
Can you spell your last name for us?
So I'll spell my name.
Please
Sorry,
identify
it's Fagenholz, and first name is Peter.
And can you just
P-E-T-E-R.
Can you just identify how we should identify you?
I'm a trauma surgeon at Mass General. Thank you very much. Thanks.
Doctor.